I worked in different health departments in different states in Australia, working as an epidemiologist, as a public health practitioner. After working in 30 hospitals around Australia, I had an opportunity to put my professional skills to use in a humanitarian aid project in the South Pacific. And after spending a number of years there, I thought that I could make a contribution to the greater humanitarian context, and so started working for different non-government organisations in humanitarian aid projects in different parts of the world. The intensity and severity and impact of natural hazard disasters was becoming more intense, so that the number of people affected and the severity or acuity of their effect was increasing. My thesis is how we reduce the death of people who are exposed to natural hazard disasters. Because I'm come from a health background, my focus is on how the emergency health response of different communities is able to be supported to help prevent more people dying. There was a call made for any research or study that has something to add to the global assessment report. And at the time I was conducting a study that compared two things. One was the shocking Melbourne thunderstorm asthma disaster that occurred, and I was comparing that to another shocking disaster in Indonesia and Malaysia and Singapore. It was the Indonesian smoke haze crisis, and I submitted it to the process of the United Nations, and that paper was accepted and it was included as part of the process to develop the global assessment report. That was published and then given to the different countries, all the countries who met in Geneva, to listen to the scientists and listen to the science around what's happening with global risk from disasters. Deakin was the only university that provided the capacity and the facility to be able to study and think, and gave me the physical access to that space at any time. So the reason why people want to return to do a slab of research are a myriad of different things. So for me, it wasn't a matter of changing my career or finding something else. It was really about answering a question that was absolutely, still is absolutely necessary.